Okay. So which of the following is the most appropriate method for closing this type of wound? So a 25-year-old man presents to the emergency department with a superficial laceration on his palm after accidentally cutting himself while preparing dinner. The wound is clean and there's no evidence of underlying tendon, nerve, or vascular injury. So to be quite frank, I had this question, but I wasn't really sure. The answer is, I think it was, if I'm not mistaken, adhesive strips, but
Okay.
I just wasn't sure.
Okay. Yeah, I mean, this is not a really fair question for step one. This also just, it's clean, so um, you just want to clean it up, right? And then you want to whether you use non-absorbable versus absorbable, that's also debatable here, but we can talk about it a little bit, right? Just so you kind of know. Okay, when you have a cut, first of all, you have to make sure it's clean. Okay, that's super, super important. So you want to clean it out with betadine. You want to clean it out with normal saline, and then how you close it up, right? Usually, for the most part, you don't want to use adhesive strips, is because if adhesive strips are, in the medical field, we have something called steri strips, especially during the palm, right? You move your palm a lot, right? You're
Hmm.
you're moving it to grab things, right? So that skin is going to stretch a lot, and so it's just like medical grade tape. Just think of it like that, right? And so the tape will come off. So unlikely
Hmm.
the adhesive strips will keep the two edges together. Skin staples, you don't want, that's really, really aggressive on the palm, and that's not going to feel too good, right? So I wouldn't do adhesive strips or skin staples, and then no closure necessary. I mean, you can always not close it and it'll heal by itself, but it'll leave a nasty scar. So then you go between absorbable sutures versus non-absorbable sutures. Okay. There's a big debate about this. Some, people will swear that, they want to use non-absorbable sutures as much as possible because if you take it out earlier, then it doesn't scar as bad. So on a cosmetic standpoint, right, this is good. Um, and also, you can remove it. Obviously, absorbable sutures, it takes a little bit longer to absorb. So it can take up to, depending on what sutures you use, can take up to 2 weeks to months. So you don't want those sutures to stay too long. So kind of debatable, but definitely for sure you want to use sutures here. Okay.
I
They
understood.
won't ask you
Okay.
on step one, but that's just extra knowledge.
It's okay. I'll just offer some extra.
All right.